Hello and welcome to NJBIZ Conversations. I'm your host, Jeff Kanige. My guest today is Dan Drake. He is the CEO of Trinity Health PACE. Dan, welcome.
Thank you so much for having me today.
Well, thanks for taking the time. I appreciate it. Just for our viewers unfamiliar with their business, PACE stands for Program of All-Inclusive Care for the Elderly, right?
Yes, that is
Okay.
correct. We are a
And as I understand it, it essentially provides nursing home level care for people 55 and over in their own home. Now, I'm sure that's an overly simplistic explanation, so I'll ask you to sort of describe the program and what it does and how.
Well, yeah, you're basically correct of what we do. Over 55, you have to be nursing facility eligible. That means you have multiple diagnoses so that the state that you're in, and this is for New Jersey, they recognize those diagnoses to be eligible to be in a nursing home. And what we do is we provide all the services you can receive in a nursing home while you live in the community, which most people prefer. It is a program that is funded by Medicare and Medicaid. And we have very high satisfaction rate, as you imagine, because instead of living in a nursing home, you get to live at home with the same services.
Okay. Well, there's few things there that I wanted to get into a little more detail. First, as I understand, you're based in Pennsylvania, but you recently got approval to establish programs in Hunterdon, Morris, Sussex, and Warren counties in New Jersey. You were already in Camden. Those four in North Jersey were the last counties in New Jersey that did not have PACE programs. Am I right about all of
Yeah, so we are based, Trinity Health Pace is based in Livonia, Michigan. I
that?
personally live in the Philadelphia area. We started our PACE programs, though, in Philadelphia and New Jersey. Camden is one of our diamond facilities run by Sister Marge, and she just does a wonderful job. We are trying to expand in New Jersey. The state
Okay.
has put out an RFP and we applied for it. We have not heard anything yet back, but
Okay.
we're very positive because of our clinical outcomes and our performance in the past.
Okay. Well, I was going to ask then, what's involved in bringing programs to those places? What do you do? How does that work?
Yeah, the
When you're
state.
setting up a place that doesn't have any of this or any of the sort of infrastructure, I guess that might be required. How do you do it?
Yeah, well, basically, the state has to put out a request for proposal. A bunch of other programs will apply for it, and you tell them in your response to the proposal how you will start it. You know, what is the time frame? How many people you feel that you can serve in this certain county, zip code area, and then basically New Jersey is a great state to operate in because you can hire employees. There's not a shortage of healthcare employees in
Really?
the areas we operate in New Jersey. So it's advantageous for us to perform there. Plus, we do have a network of over 20 locations in the Philadelphia, Delaware, New Jersey areas. So we have
Okay.
the expertise and the bandwidth to expand.
Okay. So how many folks do you anticipate, assuming you get all the approvals that are necessary and you are able to get into these places? How many folks would you be serving? Do you think?
Yeah,
What
so
is the what's the market for this in those places?
right. In the geographic areas that we go into, we look for 250 participants.
Oh, okay.
And so we look at the density studies of people over 55 and who's going to be over 55 in the next 5 years, 10 years, 15, 20 years. And that's where we determine where we want to be.
Okay.
But right now, the state is kind of determining, hey, these counties are underserved
Mhm.
for people over 55 that are Medicare, Medicaid, dual eligible.
Okay. And they're underserved because they can't afford to go into nursing homes, or they're just the care isn't available anywhere for them.
Yeah, sometimes the care isn't available anywhere in close proximity. And you were working with the frail elderly who are mostly impoverished. So they might not have the means to actually travel 15 miles to get care, which to you and I might seem, oh, I'm going to get in my car, take my mother to an appointment 15 miles away. They might not have the transportation or public transportation to get there. So it's not available to them at that
Okay.
point.
Okay. Right. Now, you mentioned that you have to be nursing home eligible. I forget exactly what the term you used, but that meant multiple diagnoses. Are there some conditions that simply you can't handle at home, or is it really depend on the individual patient? Or
Yeah.
I guess I'm asking, what are the parameters that you're looking for?
Yeah, no, we can really handle anything if the family's involved. So we do have Alzheimer and dementia participants that come to our center maybe 5 days a week. It gives respite to their family, but when they go home, we know they're safe and they will be cared for. If you were, just say that unfortunately I had dementia and Alzheimer and lived by myself, it'd be very difficult to care for that person in our program with no real support. If somebody was living in a one-bedroom apartment by themselves, had no children in the area, a lot of the support that our participants receive are from their children, their spouse, or local churches, believe it or not, churches and community. That
All
is
right.
the greatest thing. That's why people love this program. You get to stay in the community where you lived your whole life, maybe had your children, and people know you in the community. They know you at church. They know you at the local grocery store. It's really a great program.
Right. So they're dealing with people that they've known for a long time. So it's not just they're
Yeah,
not there's not a stranger in a. I mean, I don't want to put down nursing homes and their staff,
right.
but the
No,
fact is
and
they're not people that you would ordinarily have have spent your life dealing with.
right, and we're not by no means, because we partner and collaborate with the nursing homes, because when participants get to the point where they can't live safely at home, we work with the nursing homes to put them in the right place, right? We don't want somebody to be living unsafe at home. So we partner with them. We actually own nursing homes, not in New Jersey and Pennsylvania, but throughout the country, mostly in Michigan. But you know, we think home care is great, hospice is great. They're just different services that our participants can receive at different points on their lifeline.
Okay. And is that the biggest benefit, or what other benefits can you think of? That I mean, I get being at home and dealing with people that you're familiar with. I'm imagining that has a sanguine effect on folks in their health, just being around people that they know.
Oh yeah, what happens? The socialization, less behavioral health problems. Our quality outcomes are better because, again, you're living in a home in a setting you've always lived in. We
Right.
have less trips and falls. We have less, you just think about that. When you live in your own home, you know where everything is.
Hmm.
So you're not going to trip over something. You're in a new environment, a new setting. There's more of a risk for falling, but we also have, less skin breakdown, less decubitus. Our outcomes are much better than nursing home. And it has to do with a lot of things. Family support. I mean, family
Hmm.
support, I can't say enough. Last year, we were rated by our participants, this is throughout the country, at a 94% satisfaction, will recommend. With our participants' family, we were rated at 97%.
Okay.
Because of the other thing is we alleviate the need for them to have to drive their parents back and forth to our center, which we do have a center that's attached to each geographic location. And we also take people to doctor's appointments or bring specialists into our center so that somebody can, a participant can see a cardiologist, maybe an eye doctor, a podiatrist. It's a very well thought out program that started in the 70s in California by a group of Asians who did not believe in nursing homes. They believed
Okay.
they could take their better care of their parents at home, and they petitioned the state of California to allow them to create this PACE pilot. And it has
Okay.
taken off everywhere that it has started.
Okay. You mentioned the making sure that people are safe, and I know that health systems in general that run care at home programs, one of the first things that they want to do is make sure that the slip and falls don't happen.
Yeah.
Do homes require some sort of extensive renovation in your experience, or is it a relatively easy prospect to sort of get homes ready to be able to do this kind of
Yeah,
stuff?
each individual is a little different. What we normally do is we have a team who assesses the new resident. So we go out to their home. So it could be, usually it's a nurse, a social worker, and some sort of a therapist, a physical therapist, occupational therapist. And they go out and they look for clutter, throw rugs, the common things. And we do an assessment. They're safe at home. Others, we come up and the whole porch is caved in, right? So how are we going to get that participant from their home to our van safely for our
Mm.
colleague and for the participant? So something like that, we would need renovations, and Habitat for Humanity we partner with, and we partner with other contractors who this is their the give back to the community where, hey, look, if PACE will pay for the lumber and some other things, we'll donate the time to do this.
Okay.
Major renovations are very difficult, though. I mean, if
All right.
somebody doesn't have an active bathroom, we,
Mhm.
we try to get them up to speed before they join the program, because that usually leads to nursing home placement, right? If
All
your
right.
house isn't functioning with air conditioning, heat, plumbing, electrical, it's a problem a lot of times that they really aren't safe in that environment. But we try to get them up to code and get them in the program. I mean, our goal is to get everybody who wants to join the program.
Okay. Well, you actually mentioned that the population you serve tends to be relatively vulnerable. Is that the biggest challenge you have? Is, yes, if the porch is collapsing, or if there's no indoor plumbing, that's got to be a major issue. Do you face that a lot? Is that the biggest challenge?
Yeah, that's a big barrier. That it's a
Okay.
really big barrier because we do have people who end up moving out of our catchment area, where is the geographic area, to live with their family after their house is deteriorated to a point, or their family is moving out of the geographic area. That's our biggest risk for disenrollment
Mhm.
is moving out of the network. People really don't leave the program once they're in the program because, as I said, the wraparound services are unique and they really work. Plus, you get to go to the center where we serve like a light breakfast and
Mhm.
a big lunch. It's your big meal like the nursing home. It's the dinner, and we give people food to go home with. But while
Mhm.
they're in there, they're socializing with their peers, right? It's in a geographic area, so most of them have grown up or lived or worked in the same area for years upon years. And then the specialists are there, and you get to see your nurse practitioner, maybe your physician, whoever you need to see. If you need
Okay.
therapy, we'll provide therapy in-house. If you come to one of our centers, it's like a smaller version of a nursing home. It's
Right.
more of a working area without the bedrooms. So
Mhm.
nobody lives at our location 24/7, but it's open Monday through Friday, 6 in the morning to like 7 at night for all our participants.
Yeah. So even if they're going to the center, they're still going back home
Oh
after they
yeah, they get
eat.
and they love that. I mean, the difference, I'm a nursing home administrator. I run nursing homes for Trinity. The difference is, at the end of the day, they do know that they're going home to their community that they've always lived in. And I always thought that was one of the drawbacks of, the nursing home is, 8, 9 o'clock, everybody's going to bed.
Right.
And, I'm sure that you have a different time that you go to bed than I do. But
Right.
if we were roommates in a nursing home, it's time to go to bed, Dan. It's
Right.
yeah.
Okay. All right. All right. Well, you mentioned the funding from Medicare and Medicaid. There's a lot of talk in Washington about cutting Medicaid in particular. Tell me a little bit about what you're looking at here. If those kinds of cuts go through, what's the effect going to be?
Yeah, we're very concerned about the Medicaid cuts. We work on a very slim margin. PACE is at about a 3 to 4% margin. So
Hmm.
if you cut us by 5%, it's really going to devastate us. And the
Okay.
thing that both political parties support this program, which really makes me feel great about it.
Okay.
The real problem is growth. If we don't have the infusion or this, if we don't stay the same with our reimbursement, we won't be able to open new centers and provide care for the underserved, uh, you know, areas where nobody wants to put a location. They don't even put a grocery store in most of the places we have PACE centers.
Okay.
So that's our biggest concern is the cuts will enable us to serve less
Mhm.
participants. And, we want to grow this. And I think, the fact that, because you are a reporter in this area, 11,000 people are turning 65 every day in the United States.
Right.
There's not enough beds in nursing homes. There's not enough people to provide for them in home care. This is a great alternative, and it's a very popular alternative. And as I said, Democrats and Republicans like it because we have a capitated rate that they can multiply out by how many participants we have and know what they're going to have to pay each year.
Okay.
So there is no risk in it. We're holding most of the risk where they're paying us this monthly rate. And if everything goes well, yeah, we have a good month. If everything doesn't financially, we take the risk. If somebody goes in the hospital, has a hip replacement, that's why we do so much, preventative medicine and treatment.
Mhm. Okay, now I know you've gone public. You've made statements about the potential cuts, and
Yeah.
you mentioned the fact that that there is at least some bipartisan support. Do you have any sense for what the outlook is at this point, or are you concerned, or are you hopeful that that they'll
Yeah,
come
yeah,
around?
I would say I fall closer to the concerned just because of what it can do. I've been through Medicaid reductions in PACE in the past, and I've seen what it has done. It just really puts a barrier in place for you to grow and to serve more people. And our Catholic mission and what we're based on is serving the frail elderly in our communities and in neglected and underserved communities. So, what areas are the most affected normally when there's cuts? The
Yeah.
areas we serve in. We have safety net hospitals that do a wonderful job throughout the nation. They're very concerned also. We meet almost daily, have one to two meetings a day about what would be the financial impact and what would the impact be on our capital, right?
Hmm.
We have to bring in a certain amount of revenue to receive capital to buy new vans, to upgrade our buildings, paint, put new wallpaper, carpeting, things like that. And then the colleagues, I worry about our colleagues too. If you have less participants, then what does that mean for your colleagues? So,
Okay.
yeah, it's that whole ripple effect that I think sometimes the government doesn't see. They just see that number. This is what we're going to save.
Right.
It's not who does this affect? And that's
Hmm.
how we're looking at it as a Catholic organization.
Who does this affect, and then what are the sort of unintended consequences in terms
Yeah.
of spending that might result from that?
Yeah, I think that's a great point, the unintended consequences. I mean, when I look at it, we want to move in New Jersey. We want to serve more locations. And
Hmm.
that, what does that do? It brings employment. And then it brings income and revenue to the retail stores around. Housing, right? Everything benefits when you put a PACE program there.
Right.
And the greatest benefit again is for the participants and their family. But hey, if you're a colleague looking for, or an employee looking for a new job, it's really nice to go to a PACE center that's open, like I said, like 12 hours a day versus a
Sure.
nursing home or a hospital where there's three shifts 24/7, and you'll be working double shifts, things like that. This is a nicer environment for a lot of colleagues, especially caregivers.
Okay. So, given all of that, the threats to funding and the growing aging population, you mentioned 11,000 folks turning
Yeah.
65 every day. That's been, and you're right. I mean, that's been well documented. We've covered the same thing, and we've run into that with other sorts of healthcare providers. What's your outlook for the future? I mean, are you confident that you'll be able to continue to do this at the same level? What are you planning for at this point?
Yeah, I believe it or not, I am very confident about it because of the company behind me. The
Okay.
Trinity Health is very vested in serving the elderly. So, yeah, as I said, we run nursing homes, home care, hospice, and PACE. We have been expanding to minimum two PACE sites every year and one hospice location every year. It's still in my strategic plan. We're going forward. We've already received the capital to do this. If we're awarded New Jersey, we're going to go into New Jersey.
Okay.
And, again, just so we have some sort of a bottom line, we can continue to operate. And, 50% of our funding is Medicaid, the other 50 is Medicare. So when we look at it at a 5% cut, which is still a lot,
Right.
that's 2.5% really when you look at it because it's half of our funding.
Right.
And we're at a margin right now that we feel that we can operate and continue to grow. And just very excited about the growth of New Jersey, especially because it's close to where I live and I get to oversee it. Yeah, but we just opened in Gaithersburg, Maryland, Alexandria, Louisiana. We're in Mobile, Alabama, and we've just opened sites, and the difference it's made in those communities, like I said, colleagues, employees, new people getting jobs, and then the people in the safety net areas getting care that they haven't received before.
Okay.
It's just
All right.
wonderful. It's a great feeling, and like I'm very happy with our organization that they allocate funds to us, even though it's not a high profit business. And there
Right.
have been plenty of years when we're saying three to 4% profit margin, where when you're growing, you're losing money. So when we open this site, you don't even break even for 3 or 4 years. That's why you're relying on a capital from your organization. So feel very fortunate to be associated with Trinity Health System.
Okay. All right. Well, let us know what happens with New Jersey, and assuming you
Yeah,
do get everything in order, come back and let us know how it's going.
yeah, I'd love to come back. Thank you for the questions. I think the more publicity we get, the better. And I think it's really just a great program. And if you compare it to other programs that are out there, I think it's the best.
Okay, we will leave it there. Dan Drake of Trinity Health PACE, thanks for joining me. I appreciate you taking the time.
Okay, thank you. Thank you for having me.
And thank you for watching. Until next time, stay safe, everyone.